So welcome back. We hope that you really enjoyed learning about the other attendees and got a chance to network with other leaders in the women's health tech field and to learn more about some innovations going on. I know it was hard for me to choose. I had a lot of favorite innovations that I've seen so far. So speaking of leaders and connecting about innovation, we're delighted to introduce our keynote speaker, Jessica Horwitz. A passionate leader and clinician, Jessica leads the multidisciplinary clinical teams at NURX, medical, nursing, and clinical development, leveraging her experience in growing and scaling teams, improving access to care for those most vulnerable, and implementing novel modalities of healthcare delivery. She possesses varied clinical experience, taking care of people across the lifespan, specialized expertise in HIV treatment and prevention, and a commitment to providing comprehensive and affirming sexual health services. Jessica is a recognized leader and speaker on these topics at the local and international level. She holds an undergraduate degree in journalism and dual graduate degrees in public health and nursing, as well as a postgraduate certification as a family nurse practitioner. Jessica lives in California with her husband and her 2 young daughters. So please welcome our keynote speaker, Jessica Horwitz.
Hi, everyone. It's an honor with you all. And I hope my internet is being a little weird. So tell me if I start to get choppy. I have kicked all of those 2 adorable daughters of mine off of the internet in hopes that it stays nice.
We hear you now loud and clear, so it sounds
perfect, good. Perfect. It's really nice to be with you all today. So I have to tell you, when we first started talking to the HIT Lab team about this event, I was still dropping those 2 little daughters off at school every morning and commuting to the office. And now things look vastly different as I set them up on Zoom calls with their teachers and their classmates, including the preschooler, which I have to tell you all, if you have never seen 4 and 5-year-olds on a conference call, as she calls it, you may have not yet fully lived in between my own back-to-back work calls. Even though I'm starting to settle into this new normal, I'm still taken aback by how much our world has changed and how much our healthcare system has changed just over the last few months. This is a small example, but I was watching CNN the other day and saw an ad for Microsoft Teams and how medical providers are using their products to access their patients via virtual care. And amidst the sort of like tears that came from the emotions of this, it must be sort of a sign of the times. I couldn't help but feel like there was no way that Microsoft Teams was going to have this marketing strategy just a few months ago. It sort of speaks to the world that we're all in right now. And in many ways, this really could not be a better time to continue building on the momentum that the health tech space has built over the last several years. We can move quickly and efficiently to make sure that people get the care that they need. And as a clinician who worked for many years in the traditional brick and mortar space, I have to say I often pinch myself experiencing how nimble and quick to adapt and implement incredible innovation the health tech space is, much of which you all are doing. And I'm so excited to learn more about the work that you're doing. At the same time, watching this public health emergency unfold is incredibly devastating. In addition to the more obvious healthcare and economic impacts and the health disparities that this epidemic is highlighting, there are more nuanced impacts as well, which I'm sure you all appreciate. Now that women are facing canceled appointments or being told they must come to an appointment alone while 3 kids are at home with mom as their only guardian and also teacher, soccer coach, therapist, personal chef, while also being asked to shelter in place for the foreseeable future, COVID-19 is magnifying existing barriers to women's healthcare while simultaneously introducing new roadblocks. The challenges that women in rural Texas or the inner city of Detroit have faced nearly every day in accessing healthcare now, unfortunately, are becoming the reality for women across this country. However, I also remain really positive about the future. Innovation is thriving, and innovation, disruption, and challenging the current state of affairs is giving a silver lining even in this horrific time. I think having this group assembled here today shows that we should certainly remain glass half full. We are all here today choosing to spend our time focused on novel concepts to fulfill or mitigate the unmet needs of women all over the world. And that is truly inspirational. It's really an honor to be amongst you all. I told this to my breakout group a little bit ago, that if someone would have told me a few years ago that I would be applying my clinical and operational expertise at a San Francisco tech company, there is no way that I would have believed them. I began my journey in Chicago in healthcare, caring for people living on the streets. My clinic had a street medicine program and was looking for a volunteer clinician. And as an eager and green clinician, I was like, yes, I will absolutely do that. I'll spend my evenings providing care to the homeless community, meeting people where they are in the truest sort of sense of the world. Many of these people that I was encountering and providing healthcare with were exactly what you would imagine. They were young, ostracized for their families, and many of them facing HIV diagnoses. And although as a green clinician, I quickly learned about their medical needs, I also learned that providing care to people, particularly those with sort of stigmatized health conditions such as HIV, is so much more than making a decision on their medication regimen. I learned how to listen and connect with my patients, meeting them where they were and seeing each person as a person rather than a diagnosis. Fast forward a number of years, and I was speaking at the International AIDS Conference in South Africa about PrEP, which is an HIV prevention medication, and its uptick among young people in urban communities. And in a conversation amongst many about how kind of broken and lost the US healthcare system is, a colleague told me about the co-founders of NURX. And from the beginning, their vision really struck me, offering online consultations and home delivery of medication, addressed a number of steep barriers that people often face when trying to access healthcare. And as like bizarre and crazy as it sounded, somehow these tech bros, however, they're from Norway, right? So they get a little bit of a pass. They were speaking the same language that I learned in those early days on the streets of Chicago, that healthcare is first and foremost about meeting people where they are in a way that is most convenient and comfortable to them to ensure they receive the care that they need with the respect and dignity that they so deserve. And from the perspective of a medical provider, to have the ability to all of a sudden reach an exponential amount of people that you normally would never be able to reach, geography, transportation, confidentiality, all broken down, had me super interested from kind of the beginning. While NURX was largely focused on birth control at the time, this was in 2016, I saw so much potential for how the platform could be used for HIV prevention and PrEP, things that were really dear to my sort of personal heart, and how these could help push the conversation forward with HIV prevention in women, which unfortunately are often two conversations that we sort of miss and don't go together. And I reached out to them and sort of told them who I was and said, how can we work together? And that is how sort of strangely my journey of melding my deep roots in sort of public health and community-based medicine and access melded with tech. I have to tell you, before I joined NURX, my philosophy on feminism in the tech industry is that the two do not necessarily go together. I sort of had this deep held belief that I was a feminist, and I had also a deep held belief that maybe that does not go hand in hand with working in tech. And I felt in some ways that these could be sort of diametrically opposed. Like, how does the idea of women having control of their bodies and having access to healthcare, like how does that necessarily fit with tech? And what I've been surprised and encouraged to learn, as you all know very well, is that there are no rules when it comes to tech, and that is so freeing. And that you can have these deeply feminist causes like access to women's healthcare, and you layer it in with technology. And if done right, with the right people at the table, there's actually this immense power that happens when you put those two things together. On the idea of disruption, I have to be honest, I've sat on all panels before about like, how do we disrupt the space? And I used to honestly like eye roll on this. I felt a little bit like, as a healthcare provider coming from this traditional background, there's sometimes resentment with these people that have like zero medical training, that have this like brand new coastal idea, and they're gonna just sort of like disrupt something that decades of expertise have been trying to fix without necessarily the institutional knowledge. And, it's this notion that as much as I agree, like, my gosh, I agree, I think we all do agree that our healthcare system is broken, right? Like, there is no question. I resented in some ways this idea of like, oh, here we are with this like San Francisco tech company, and I have a solution to fix this broken system. And I learned quickly, though, that you won't get far without bridging the gaps with the traditional healthcare system. That when tech actually comes with humility, and the healthcare system, as much as you can, brings some humility, that is when that there is room for collaboration, right? I always will tell people that like there is so much room at the table in this like messy healthcare system that we live in, and our joint efforts and collaboration is what will allow for true change. At NURX, we consider ourselves a complement to the traditional system, right? Where we feel like we are here to fill in the gaps in care and services that our team is confident that we can safely provide, but we recognize with such humility that we are not a one-size-fits-all solution. And that, however, we can make an impact on closing these gaps by simply reimagining what healthcare can look like, right? Asking those questions of like, what does it look like to do things differently? So how I oftentimes like to reframe this thinking of disruption is it's really about challenging the status quo in terms of what's acceptable, who has control and power, who shares the decisions, what is talked about, what is valued. And like, I don't know about you all, but I definitely feel like that is all worth disrupting. And that is what will help bridge the gaps in terms of bringing on advisors, bringing on support, and not to mention bringing on the dollars that we all need to do the work that we're doing. I have to say, if I had known that, I may have started working in this tech space much earlier in my career. Something else that I found surprising about working in health tech is what attracts an investor. Much to my surprise, what I found to be rewarded and applauded, thankfully, is a clear vision and big ideas that break boundaries. While this seems counterintuitive when you're in the boardroom, I have to tell you, it is best to focus on your mission and less about what you think investors want to hear. What might not be sort of fundable on paper, certainly what may have not been fundable in the past decade, will actually allow for the greatest impact on our healthcare system. And any investor worth working with recognizes and appreciates this and will want to fund you because of it, not despite of it. I tell people all the time, like, don't pretend like you're something that you're not. Focus on your mission and the investors will follow. And getting investment about something that you don't believe in is not the investment that you want, truth be told. Today, NURX provides care for over 250,000 women across this country. In just a few short years, we provided care to 500,000 women across this country. And what I have to say, when I tell new providers joining my team this, they can hardly believe it. As a medical provider, it's a bit overwhelming to think about the fact that our team has been able to provide care to so many women that I would never, ever have been able to reach, simply because our team asked the question and continues to ask the question, isn't there a better way we can do this? When I joined NURX, I had this perspective. There has to be a better way for people to get the care that they need. I care about this mission deeply, but I have to be honest, I didn't know if the VC world was going to care about women's health and HIV prevention and affirming sexual health the way that I did. When I joined NURX, they were a tiny, scrappy little company that barely had, sort of some seed money to sort of be able to function with. And to be in a world now where women's health is slowly starting to gain the attention it deserves, I have to tell you, like, all I have to say is like, finally. At the same time, I think it's important to recognize that even though the women's health tech space has made significant strides over the last several years, there's a lot of work to be done, right? I think we can all agree that most of the decision makers are still men, including those who control the pocket strings. We have to make our case that much stronger and that much louder, and that's not necessarily fair, but there is significant momentum, and that is really exciting. Now more than ever, in some ways, we're experiencing a tipping point for women's health and tech. And in some ways, COVID to some extent is to be credited for a little bit of that. We have the attention from decision makers and the purse string holders. And we also have the attention of women experiencing healthcare in a brand new way for the first time. I strongly believe that for many of these women, they're going to realize, like, oh, there is a different way that I can get my healthcare needs taken care of, and this feels good to me, and why would I go back? We at NURX were seeing this well before COVID with our, many patients across the country, where they say things like, why would I go back to the way before where it didn't always work for me? And, I always have this sort of anecdote where, it's this notion of like, yeah, I really liked having my birth control held hostage until I went in for my yearly exam done by a 75-year-old white male doctor wearing a white coat standing over me, said, no woman ever, as it related to her healthcare. And thank goodness we are sort of hopefully at a place where we're giving people different options. What also keeps me on my toes is this very group here, I have to tell you all. As more innovative ideas are brought to the table, the bar gets set higher. The pressure will be on for companies like NURX to provide care, not just in new ways, but in the best way possible. I always tell my team, like, competition is great. It forces companies like ours to rise to the challenge. So we welcome your ideas and your energy. I feel more confident than ever that we are really in this together. And I look so forward to being your colleagues in this amazing space. And I'm so excited for, in some ways, what the future holds. And thanks for listening. And I have to tell you, it's so strange to talk to you all in an environment like this. So if you have questions, I'm happy to take them. And thanks again for having me.
Absolutely. Thank you so much, Jessica. Audience, just a reminder, if you do have questions, please submit them to everyone on the chat. And I'm happy to ask them for Jessica. We have some questions rolling in. So how have you seen women's healthcare adapt to the challenges of the current pandemic? And can you speak to, what NURX is doing specifically as well?
Yeah, so I think, so women's healthcare at large, I think that there has been this shift in focus to access and telemedicine in terms of reduced regulation and breaking down barriers. We sometimes say like 15 years of regulation changed overnight with this pandemic. So and that's been across the spectrum, right? So you have these very traditional systems. We're working with an advisor right now on a new service line who works for Yale. And, she's been talking about telemedicine for a decade and they're like, oh, no, our patients aren't interested. Like, oh, no, like that's not something we're going to do. And now all of a sudden they're like, oh, we're going to do telemedicine to survive, right? And so there is this way in which, like, even the more traditional systems are really sort of adapting to the sort of current state. I think for NURX, and I think across the board, it's also about thinking about how do we provide more holistic care, right? So NURX to date and a lot of other companies, they have these kind of point solutions that they're like, we're going to solve for contraception. We're going to solve for PrEP. But the reality is that probably always, truth be told, but this is just illuminating it. There's need for more comprehensive care. There's need for like understanding that women need more than just their contraception. They need a place to address their mental health. They need a place to, if at the very acute thing, address the yeast infection that they have, right? And so thinking through sort of how do these solutions provide more holistic care in a safe, comprehensive way, and not saying you can do something that you can't, is becoming that much more important. And it's just highlighting it in a big way with COVID.
Yeah, absolutely. And also with COVID, we've been seeing, a lot more inequalities in access to healthcare in underserved communities, especially, such as communities of color. Is there a way that, digital health or telemedicine has a space there in providing, health equity and building access to health in underserved communities?
Yeah, totally. So we oftentimes, unfortunately, people come to NURX for lots of different reasons. Well, that's not unfortunately, they do, but they come to NURX for lots of different reasons. And a lot of times why they come is because they either have had sort of a not so good experience with the traditional healthcare system, oftentimes rooted in healthcare inequality, rooted in stigma, rooted in racism that happens in the traditional healthcare system sometimes, right? And so this is a safe place where people can get the care that they need in an affirming way. So that is definitely one thing. And then the other thing is just kind of like geographical access, right? So there's all kinds of things that impact people's ability to access, particularly reproductive care, right? And some of it is just like, where do I live and do I have a place? But also, do I have a place that is going to give me the care that I need, that is going to like sort of allow me to make control and decision-making over my contraceptive decisions? Then you amplify that like times 1,000 as you think about HIV prevention. And so, those type of things in some way, telemedicine done well, allows it to do. Although the reality is that there's still challenges, right? Like you have to have access to a smartphone, you have to have access to technology, you have to have access to internet, right? Like, so there's other things that it's not solving for, but it's doing a pretty good job of it. We also have a pretty strong commitment to sort of have community liaisons whenever possible, knowing that particularly for some things, you have to have trust, right? Like, why would you necessarily just trust finally this tech company coming in and saying you have a solution? So we work with community organizations around sort of community capacity building, things like that as well.
Yeah, that makes sense. We have some questions incoming about, where you started and where you're going. So So to say, how did the company expand its patient base, and how did you work? Did you work with small groups to get adoption? And how are you, recruiting more people to use the app? And then secondly, where do you think, siloed healthcare systems like NURX, where are you going? Is there a long-term goal of being integrated with larger healthcare systems and health plans?
Yeah. So in terms of growth, so a lot of it was honestly like right place, right time, organic growth, to be quite honest, for NURX. So in the beginning, we were really fortunate that we launched in California, a scrappy little app and a few people, and it got picked up by MTV. And we got sort of free advertising, and all of a sudden tons of people knew this weird company that had too many consonants and not enough vowels, and no one could figure out how to pronounce the name, but they could figure out how to like put it in their search bar or download the app. And so we continue on that momentum of sort of like organic growth through word of mouth and people sharing experiences. We also do lots of search marketing right now. So now when I started, we actually did not have a marketing team. No one doing that. But now we definitely have a marketing team who play a really strategic role, both in sort of like paid marketing, but also partnerships. So thinking through kind of how do we have partnership relationships with companies, with schools, with sort of like, community organizations to be able to have some sort of more organic growth. We also sort of were strategic about states that we went in. So for those of you that are familiar with the telemedicine space, you know that there's different regs as it relates to what you can do in California versus what you can do in Louisiana versus what you can do in DC. So we had a sort of strategic growth plan to go into new states based on population size, right? So we are in 30 states now, but we serve like over 85% of the US population in terms of population size. So there was a strategic notion of like, where do we go next as it relates to how can we reach the most people, and also who has the biggest access areas, right? So Texas happens to be a state with a lot of people, but they also have huge access challenges as it relates to contraception, right? So the majority of our patients in Texas live in contraceptive deserts, meaning they live miles away from a healthcare provider to provide contraception, right? So some of it is strategic decisions around mission as it relates to access. And then in terms of sort of where we're going next, so yeah, I mean, I think we definitely have a strategic plan to move out of this kind of point solution and sort of service line node modality into a sort of like digital health practice that provides more holistic care for people. I think you have to be careful with that, right? Because you don't want to, NURX is really mindful, like we don't want to be like a Frankenstein of service where we offer like, ear infection treatments and STI treatment, it doesn't, that's not the motion we're going. So a really strong focus on sort of mission and direction on sort of like what we sort of loosely call these sensitive health topics that feel relevant to people that we're caring for, and improve access. And then I think the future is a bit unknown of what that looks like. Does that look like, we definitely have plans to sort of start to work with payers in terms of health plans, in terms of sort of just opening up access points. But in terms of sort of what does it look like to work with a large health system to be able to be their digital healthcare provider, right? What does it look like to work with a state plan? We do some things right now around PrEP where we work with some state sort of PrEP programs to be the sort of digital health provider for those states. And so there's more opportunity for that around other service lines that we provide as well.
Great, thank you so much. We also had a question about you, and you kind of started to touch on this, but whether there are areas with great opportunity, especially now for adoption in the women's health tech space. Are you seeing, areas where, NURX might get into that seem to be underserved at the moment, and, your platform could really provide a vessel or a venue of service?
Yeah. So a lot of our new direction comes from sort of what do our current patients need and want, right? So we have a pretty amazing patient base that tells us all the time what they need and want, which is a really amazing place to be in, because you're not sort of shooting blind and saying like, oh, like let's start doing X, Y, Z, and that's not what our patients want. That doesn't mean we don't develop things to bring in new patients as well. So a lot of this is like issues that people that are accessing contraception are looking for, right? So things around kind of sort of skin issues and migraines and mental health. And sort of, we are doing a pilot right now around HIV treatment because we are detecting all these new positive infections with people on PrEP. So what does it look like to actually hold people long-term for HIV treatment? So instead of just reinventing the wheel and saying like, how can we pull in more and more patients, our strategy is really focused on what sort of issues do our current patients have, and right, and then if we can, where's the level of priority, right? So our clinicians are like, let's do everything. Yeah. They are like, you know, what can we do and how can we do it? But we have to make strategic business decisions about investment, and also like technical investment, right? So how do we work with our tech teams to make sure that we have the infrastructure there to be able to provide that care? So it's an exciting time to sort of start to think through like, how do we round out and provide more holistic care to people?
Yeah, absolutely. Thank you so much, Jessica. We're out of time for the Q&A, but this has been so helpful, so interesting. And thank you for lending, you know, your specific lens and expertise to inform and give us some context really for why we're all here today. So thank you again.
Of course. Thank you for having me.